Welcome to the Ohio Health Surgical Weight Management Program. My name is Chris, and I'm one of the nurse navigators. The overall goal of our program is to help you transform your health and life through a safe, minimally invasive surgical approach. Our program is unique as our multidisciplinary team works together for you every step of the way. The care team consists of physicians, nurses, dietitians, psychologists, exercise physiologists, and support staff. As you begin this process, we ask that you really evaluate your commitment and readiness to make the lifestyle changes that are required in order for you to be prepared and approved for surgery. This will include, but is not limited to, eliminating caffeine and alcohol, as well as being nicotine-free. Some of these changes can be challenging, so it's important that you begin this process today. We are here to help you navigate the physical, emotional, and social effects of weight loss. We will help to guide you through your journey as we not only prepare you for surgery, but also stay connected with you after your surgery to offer our continued support in your success.
Hi, my name's Brittany and I'm a dietitian with Ohio Health Weight Management. As a part of our program, you'll be working with a dietitian who will provide education and support as you go through this big change in your life. Lifestyle changes will be necessary in order to be successful after this procedure. Your surgery is a tool. You must know how to use it in order to be successful. Compliance with lifestyle changes is necessary to prevent complications and negative outcomes after. Without eating a healthy diet and taking your vitamins, you may experience nutrient deficiencies. You could experience hair loss, gastric ulcers, nausea, vomiting, diarrhea, and dehydration if you are not compliant with the lifestyle changes. So we require that you make these lifestyle changes before your surgery. Why do we want you to make these lifestyle changes before? Well, we want you to be prepared. We want you to form new good habits that will support you after your surgery. Practice makes perfect, so practicing these changes is going to ensure that you have healthy habits after. We want you to apply your knowledge, not just have the knowledge, but be able to apply it to everyday life. Eating smaller, more frequent meals will be one of your lifestyle changes. This is important to maximize your metabolism and help to promote a little bit of weight loss before the surgery. If you're diabetic, making these changes before your surgery can help to better control your diabetes. So what are these lifestyle changes that you're going to be required to make? You must consume small, frequent meals throughout the day, about every 3 hours. You'll be required to reduce your portions to promote hunger every 2 to 3 hours and to get prepared for the small portions that you will be consuming post-op. You must reduce your fat and sugar intake and choose nutrient-dense choices. You're dealing with a very small space after your surgery, so nutrient-dense choices are very important. You will need to consume adequate fluids. You will need to avoid caffeine, carbonation, and alcohol. You will need to practice eating slowly and mindfully, and you'll be required to take vitamins for the rest of your life. Meal planning is essential after your bariatric surgery. You will be required to consume 5 to 6 small meals throughout the day, about every 2 to 3 hours. Your volume will be very restricted after your surgery. Meals are going to be about the size of a cup, so we want to make sure that we're filling that cup with nutrient-dense choices. You will also have to reduce your fat and sugar intake after the procedure. Dumping syndrome is something that can happen if you consume too much fat or too much sugar. So it is important that you find alternatives to your favorite high-fat, high-sugar foods. The dietitian will assist you with this and modifying your other recipes. We want you to be able to identify safe foods using the food label, which you will also discuss with your dietitian. Fluid intake is extremely important after the surgery. You will be required to consume a minimum of 64 ounces a day, while others may require 80 to 100 ounces. Your body is made up of 60 to 70% water, so drinking enough fluids is very important for all your body processes to be operating correctly. You must sip slowly and frequently throughout the day. You are not able to chug a drink after the procedure, so sipping constantly, carrying a water bottle, and making sure that you don't fall behind is very important. You will need to avoid caffeine, carbonation, and alcohol after your surgery. You should consume beverages that are sugar-free, decaf, and non-carbonated. Carbonation is any sort of bubble in your beverage, such as what is in soda and carbonated waters. Adverse effects can occur after the surgery if you do not consume the right fluids. Dehydration is very, very, very easy to come by after the procedure. You can also experience nutrient deficiencies and ulcers if you're choosing the wrong beverages. It is very important to practice safe eating for after your surgery. You must eat very slowly and very mindfully. Your stomach is very small, so you must take small bites and chew them very well. Your bite should be about the size of a dime. You should pause between each bite and wait about 10 to 15 seconds before taking another one. Your meal should take about 20 to 30 minutes to eat. You will be required to take vitamins and minerals for the rest of your life. Your dietitian will review the exact vitamins that you will need to be on. Why are vitamins necessary? Well, your food volume is going to be very, very decreased compared to what it is now. You will also not absorb things as well. And remember, you will need these for the rest of your life.
I'm Dr. Turner, one of several psychologists within the Ohio Health Weight Management Program dedicated to helping you achieve your weight loss goals. Your first contact with the psychologist will occur at the time of the psychological assessment, which is required by our program and your insurance company. You may wonder, why is the psychological assessment important? What's the purpose of the assessment? Well, it allows us an opportunity to explore your readiness to make all the necessary lifestyle changes for surgery, including the behavioral changes, the dietary changes, and exercise changes. The assessment allows us to determine your motivation to sustain lifestyle changes associated with positive surgical outcomes. What is influencing your decision to pursue surgery? Are you sufficiently motivated to make significant lifestyle changes and sustain them over time? Any psychological concerns that might impair the surgery itself, weight loss, and even weight loss maintenance will be addressed. We encourage our patients to be open during the assessment process so that we can provide the support necessary to create successful long-term change. Please know that having a psychiatric diagnosis, a counseling history, even a history of psychiatric hospitalization does not, in and of itself, disqualify one from surgery. It is important for your psychologist to get a comprehensive understanding of your psychological history. Therefore, we encourage you to be forthcoming during the assessment. Finally, it is important that you make an informed decision about undergoing bariatric surgery. Therefore, during the assessment process, we provide education about the procedure that you are electing and the risks and benefits associated with surgery. Here is what to expect when you attend a psychological assessment with one of our psychologists. The assessment process is lengthy. It takes 3 to 4 hours, but could be longer if you need additional time to complete testing. Please note that the testing is in written form. If you have difficulty reading or comprehending the English language in written form, or if you are visually impaired, please let us know when you schedule your assessment so that we can provide appropriate accommodations. Some insurance companies may require you to complete your assessment in 2 visits rather than 1. Molina and Buckeye Health, for example, require prior authorization for psychological testing. Therefore, you will complete the first half of testing and return for completion of the second half once authorization is granted, and that usually takes about 10 business days. If your insurance company does not cover psychological services provided by Ohio Health, you will need to complete your assessment by a provider who is covered by your insurance. We are able to provide you with a list of psychologists outside of the Ohio Health Network who perform assessments for our bariatric patients. Expect to receive feedback about your assessment results within 4 weeks. Completing additional recommendations such as individual counseling or a medication evaluation may be required and will need to be completed before insurance pre-certification for surgery. Keep in mind that weight loss surgery is an elective procedure and may not be safe medically or psychologically for everyone wishing to pursue it. If it is determined at the time of the evaluation that you require additional services to reduce the psychological risk factors, our team may provide you with appropriate referrals for treatment that will allow you to proceed with surgery in the future. Our team may also provide you with non-surgical weight loss options that are available within the Ohio Health Weight Management Program that may be a better fit for your weight loss goals. Beyond the psychological assessment, the psychologist in the weight management program can help you with your weight loss in a number of different ways. We can work with you to help you understand your relationship with food, to help you understand any barriers to weight loss or triggers for unhealthy eating. We can help you develop strategies to prevent relapse. We can also support you with emotional issues that may emerge after surgery. There is group support available to you as well, including an education program series that meets once a month, Pre and post surgical patients are encouraged to attend that meeting on the third Tuesday of every month at 5:30 p.m. here at the McConnell Heart Health Center. There are also 2 support groups available for those who have recently undergone surgery and for those who have undergone surgery and are now working on weight loss maintenance. You will learn more about those groups once you have undergone surgery. Finally, to receive psychological clearance for surgery, your psychological evaluation must be completed. If there are any requirements outlined in your evaluation, they must be completed as well. And please remember that you must be nicotine-free before being cleared for surgery. I hope this segment has been helpful to you in understanding the psychological assessment and how our team of psychologists can assist you in achieving your weight loss goals. Best wishes to you on your weight loss journey.
Hi, I'm Natalie, and I'm one of the exercise physiologists and a tobacco cessation specialist here at McConnell. Exercise is a key component to both weight loss and the maintenance of your weight loss. Without intentional physical activity, our bodies will lose lean mass as our weight goes down. This muscle is one of the driving forces of our metabolism. Physical activity is another way to improve other indicators of our health, such as blood pressure and blood glucose control. Becoming physically active is one of the behaviors you can begin to develop before surgery. It's important to start at an appropriate intensity that aligns with your current fitness level. Walking, getting up during TV commercial breaks, taking the stairs when you can, and even parking farther away are all good ways to increase your physical activity. There are 3 components that make up an effective exercise plan. They are cardio, strength, and flexibility. Cardio is the type of exercise that moves large body parts and actually increases your heart rate. This would include activities like walking, swimming, or hiking. It's important to get this type of activity 3 times per week at a minimum. Strength training involves moving or pushing weight or using other forms of resistance. These modalities include free weights, resistance bands, body weight, and water fitness. This type of activity is recommended 2 to 3 times per week, but if you are new to these exercises, start with 1 day. Flexibility involves stretching and range of motion exercises to improve joint health and reduce the risk of injury. Modalities include yoga, tai chi, static and dynamic stretches. We also offer a program here at McConnell for an additional fee that is for pre- and post patients in our bariatric population. It's called Step It Up and involves small group exercise classes with an exercise physiologist. The program is 8 weeks long and includes access to the McConnell Fitness Center during that 8-week period. Contact our weight management department to learn more. Best of luck with your weight loss journey.
To be approved for your surgery, all nutrition and lifestyle goals must be met. The number of insurance-required visits with a dietitian is a minimum. You may have additional visits based on your progression towards the goals. You are required to complete food records, such as these on this form, and bring them to each dietitian visit. You must also be cleared by a psychologist. Medical testing will be determined by your insurance and will be reviewed with your nurse navigator. You must be nicotine-free, and the entire interdisciplinary team must be in agreement that you are ready for the surgery. From our team to you, we wish you luck on your journey.